Depression, Case History 3. A 48-year-old man had been suffering from depression for over 10 years. He was successful in his profession, but in the last 10 years, he felt increasingly dissatisfied and questioned the meaning of life. He was happily married and had no financial problems. His depression manifested with a low mood, a sense of frustration and irritability, a lack of drive, and a feeling of pessimism. From the physical point of view, he had a few problems, but he did suffer from lower backache and low libido. His pulse was wiry but empty at the deep level. His tongue was reddish-purple on the sides and had a deep heart crack. After seeing the deep heart crack on his tongue, I asked him some more questions about his depression and personal history. A deep heart crack on the tongue always indicates that the person had either been subject to severe emotional stress for many years or that he or she has a family history of mental emotional problems. When I asked this patient about his family and personal history, he said that his father had suffered from depression for many years when he was a child and a teenager. His memories of his father were of a man who was in a grip of major depressive disorder and hardly ever left his bedroom. This had affected him deeply, although he himself did not realize this. Therefore, the deep heart crack reflected this situation. The clinical significance of a deep heart crack also concerns prognosis. In fact, such a crack always indicates that results will be slower to come. Diagnosis. His wiry pulse and the sense of frustration and irritability indicate liver qi stagnation. As the sides of the tongue were purple, this indicates that the qi stagnation has given rise to blood stasis. The stagnation of liver qi and liver blood contributes to the depression as they restrain the coming and going of the ethereal soul. The emptiness of the pulse at the deep level, lower backache, and low libido indicate a kidney deficiency. The kidney deficiency induces a weakness of willpower and therefore a lack of drive and enthusiasm that contributes to the feeling of depression. Treatment. The treatment adopted was to move qi, soothe the liver, invigorate blood, and tonify the kidneys. I used primarily acupuncture and some three treasures remedy. Bladder 23, Sen Shu, Ren 4, and bladder 52 to tonify the kidneys and strengthen the willpower. Liver 3, bladder 47 to move liver qi and invigorate liver blood and stimulate the coming and going of the ethereal soul. Heart 7, Heart 5, and Ren 15 to nourish the heart. Do 20 and Do 24, Shenting to lift mood. I treated this patient with acupuncture only once a month because he lived a long way away. He started to improve after 3 months of treatment with acupuncture and the herbal remedy. After 18 months, he felt a lot better in himself, and he was not feeling so frustrated and dejected, and he felt much more enthusiastic about life, so much so that he found the mental drive to make a radical change in his career. A deep heart crack such as the one he had cannot completely disappear, but it did get less deep. Thank you for listening.